that under Medicare right now for the Part D coverage, I believe it was, that you would pay the premium, but there's a certain point where you continue paying the premium, but you don't get any health care benefits until your out-of-pocket costs reach a certain level. And I forget exactly what the dollar amount is now. You may recall. Do you recall what it is, Dan?
It's changed over the years now.
It keeps changing.
Yeah.
But basically there's what's come to be called the donut hole, which really is another way of saying you're still paying the premiums, but you're getting no health insurance coverage until your out-of-pocket costs hit a trigger on the other side of the donut hole, and then the coverage resumes. And of course you continue paying the premium. What the Affordable Care Act does is ultimately to close that donut hole so people are not in that position where they're continuing to pay a premium but actually not getting a health care benefit.
So that donut hole will be closed.
Will be eliminated.
It's a process.
Right.
It's a process.
Which would unfold over a period of years. Right.
So some people may have never reached the donut hole, but other people are reaching it in November of a year. Some people are reaching it in July.
Exactly.
Depending on the type of medicine that they're taking. Some medicine is more expensive than others, and so forth. But the older you get, the more medical services you need, and the greater your use of Part D prescription drugs.
Right.
And so that donut hole, the fact that is in the process of closing, is something.
That's a significant step forward, especially where you're talking about seniors who are living on fixed incomes. We've seen the decline of defined benefit pension plans.
Yes.
More and more people are living on defined contribution pension plans, and incomes are limited. So it's a significant benefit for seniors in the law.
Okay, and also for seniors as well as others, preventive health services.
Right.
Explain the concept behind that.
This basically, the Affordable Care Act has a provision that says that you are going to be able to get screenings without significant out-of-pocket costs for screenings for preventive health situations such as a lot of the cancers. So for men, prostate cancers. For women, breast cancer examinations or cervical cancer examinations, and that insurance companies are going to have to pay for those. And that's a significant provision in this law because, of course, if you can screen and if you can catch these cases earlier when they're treatable, it's much less expensive to treat a pre-cancer diagnosis than it is when somebody has a full-fledged cancer. And so obviously this will help save some money too in the long run.
This reminds me of Head Start. As far as it's better to spend money early
on the front side
right. of children before they enter school, and with health care,
right.
catch a problem early before it becomes a crisis.
And we should say, many of these things we've been talking about the past couple of minutes, Dan, these are the so-called insurance reform portions of this big complex law. What's interesting to me is that you hear so many people out there now saying they want to repeal this law, but they haven't told us what they'd replace it with. And it's worth remembering that many of the same people in Congress today who are calling for full repeal of this law, they want to get rid of all of these provisions, but they keep picking the ones that are most popular with the public and saying, well, the one about no denial of pre-existing conditions, that's good, we should keep that. Or we should allow people to carry their kids up to age 26, that's good. But it's a funny thing, when they were in the majority in Congress and they had a chance to pass legislation like that, they didn't do it. And in fact, when people brought those proposals up, they actively opposed them. But now they've had a conversion because the more people see about some of these insurance reform provisions in other parts of this law, the polling shows that it is popular with people, that people want those provisions. They don't want to be at the mercy of insurance companies that can drop them for pre-existing conditions or for any reason, or impose lifetime limits on coverage.
So the opponents have picked up and coined a word that was not there, Obama care. And for people who don't like the president, that was very easy for them to rally against. But when they find out that some of these very good very good items in the insurance in the act, you find out, hey, we really like those.
When you start talking about specifics, people like many of these provisions that we've been discussing. Now, I don't think it's the case either that this is a perfect law. I worked in Congress for many years, and I never saw a perfect law during the years that I was in Washington. I think the way things work in America, we usually pass something, we find out what works and we keep it, we find out what doesn't work, and we either improve it or we change it. And I think that's probably what's going to end up happening with this law now that the Supreme Court has removed this cloud that was hanging over it about the constitutionality. That debate is over. And now let's get about the business of actually implementing this law so that we can extend health care coverage and start reducing these escalating costs for health care.
When you say that part is over, the case has been settled by the Supreme Court.
Right.
Polling supports that too.
Right.
That people have said, okay, it's time to move on. Let's make it work, and we'll see about making changes here or making changes there. The Social Security Act that we have now, that was passed in before I was born, in 1935, is not the same act as the 1935
That's right.
Act.
And Medicare that was passed in 1965 is different today than it was in 1965. So I think at the core of it, Dan, I think Americans are really very pragmatic people, that we keep the things that work, but if something doesn't work the way it's supposed to, we fix it. We don't throw the whole thing out.
So you had mentioned some people have said that they want to repeal Obamacare, since they're criticizing it, and but not coming up with an alternative. Even Mitt Romney has said, first day as president, I'm going to repeal. Strictly speaking, you are a lawyer. Strictly speaking, does the president have the power to do that?
Well, of course, our system doesn't work that way. It may sound good as a soundbite out on the stump if you're running for president the way Governor Romney is, but in fact, he can't repeal it. It would require another act of Congress to repeal this law. There may be some executive authority that the president has, and I'm not intimately familiar with what all those aspects would be. There may be some executive action that he can take, but in terms of just on day one signing an order repealing the Affordable Care Act, he doesn't have that authority, and he knows that, but it sounds good on the campaign stump.
It's a soundbite.
Right.
So to what extent do you think the Affordable Care Act will be on people's minds as they go to the polls in November?
I think there are going to be some people on the right who are deeply energized by this issue, and there's no question that it will be in the forefront of their minds. I don't think that's where most Americans are going to be on Election Day in November. I think the main concern this election is going to be about the economy. Everything that we hear people saying, and when you talk to voters, all the polling indicates this, their number one concern is the state of the economy. Are they going to be able to have a job? Are they going to be able to make enough money to support themselves and their families? Are they going to be able to afford to keep their kids in school? Really very basic bread and butter economic issues are going to be at the forefront. And I really don't see this as the premier issue of this election, even though some people would like it to be. I think the debate has moved on.
It'll be in the top 4 or 5.
I think that's probably true, but I think the economy is going to be front and center, the number one issue.
Gold, silver, and bronze.
Yep.
Yeah, first, second, third. Since we're talking politics, recently Mitt Romney announced that his choice for a vice presidential running mate, and that's Congressman Paul Ryan of Wisconsin. How does Paul Ryan stand on the Affordable Care Act or Medicare or Social Security?
Well, of course, Paul Ryan was a congressman from Wisconsin, is a congressman from southern Wisconsin, and he opposed the Affordable Care Act. The budget proposal that he submitted to the Congress actually provided for repeal of the Affordable Care Act. But when you look at the budget that Representative Ryan put before Congress, I would say it's not just a bad budget, it's a terrible budget, especially for seniors when you look at what it would do. And I'll cite a couple of figures that I got here. The Alliance for Retired Americans took a close look at Representative Ryan's budget proposal for 2013. He would repeal the Affordable Care Act. That would leave 34 million people without health insurance coverage. He'd replace Medicare's guaranteed benefits with so-called premium support payments to beneficiaries. Others have called these vouchers, where basically it wouldn't necessarily cover all of your health care costs. This means that seniors would end up picking up a significant portion of their health care costs out of pocket. The Congressional Budget Office has estimated that new beneficiaries in Medicare under the Ryan budget plan could pay more than $1,200 more by the year 2030 and more than $5,900 more by 2050 if his budget were to be implemented. And I can't think of many seniors who would be standing up right now looking at this and saying, gee, that's a great idea for me to pay up to $5,900 more by the year 2050.
Yes, that's some difficult issues for the, but the party embraces those.
Yeah.
The one party embraces those, to be sure. So, looking at Medicare, is it fair to say that Medicare provides for health coverage for people age 65 and over? It's for all people age 65 and over.
Yeah, I think
universal health care coverage.
Well, I think it covers it. It definitely is a significant benefit to people age 65 and over. But we have to remember that the other side looks at these things and basically they approach it from a philosophical point of view that says individuals should be responsible for this. Government should not have this big a role. Government basically should not have a social safety net. And I think what we're about to see this fall is going to be an election contest that really is going to present Americans with a very stark choice about what kind of country they want to live in. Do we want to have a country with a minimal safety net that provides dignity and health care for people, especially in their later years in life? Or do we basically want to say, you're on your own? And it's interesting to me, people talk about how brave Representative Ryan has been with his budget proposal. I don't find it brave, actually, to suggest to other people, especially to seniors and low-income people, that they should bear the crux for balancing the budget, when at the same time, he would use the savings from cutting Medicare and Medicaid and use that to pay for tax cuts for millionaires. Under the Ryan budget proposals, Mitt Romney would only be paying less than 1% of his total income in federal taxes. I don't think most people are going to relate to that, and it's going to be a very interesting campaign when the country has this very stark choice before them. The Ryan plan is definitely not the only way to balance the budget and reduce the federal debt. That President Obama's proposals for a more gradual approach, an approach that looks at specific, justifiable spending cuts, but also looks at making the wealthiest people in this country pay their fair share in taxes, is a much more reasonable approach in my view.
Going back to the preamble to the Constitution, one of the purposes of our government is to promote the general welfare. General welfare. That means all of us.
That's right.
It does not mean the welfare of the very rich. It's not for the top 1%. It means the welfare of the 99% as well. So we really have to look at all these details and carefully consider them.
That's right.
One issue that bothers me a little bit in the Ryan proposal, as people talk to seniors, they say, well, don't worry about it. It's not going to affect you because you are already retired, or you are 60 years old. It's not going to affect you. I have adult children.
That's right.
Other people have adult children, adult grandchildren, and even great-grandchildren coming up. Yeah, we care about them.
Yeah,
we care about them. It's not just looking at our, if a person were age 80, 85.
It's worth mentioning one last thing. I know we're starting to run out of time. How much time we got, Dan? We're out.
We're out. Okay.
We'll save it for next time.
Steve Francisco, our award-winning director Roger Carlson is whispering in my ear that it's time to wrap it up. So I know of no better guests that we have had than you for explaining some complex federal policy issues. And glad to hear about the many positive aspects of the Affordable Care Act, as well as some of the major concerns and a little bit of the background of the Supreme Court decisions. Watch for future programs on significant public policy issues. And Voices of Experience has been brought to you by the Minnesota State Retiree Council, afl-cio.